Have you ever wondered why some colonoscopies need to be repeated? Surprisingly, one of the most common reasons is not the procedure itself, is poor bowel preparation. A successful colonoscopy begins several days before you even enter the endoscopy unit. Preparing your bowel properly is just as important as the examination itself, because a clean colon allows your doctor to clearly see even very small polyps that could otherwise be missed. If the bowel is not adequately cleaned, important abnormalities may remain hidden. In some cases, the examination may even need to be repeated earlier than expected. Preparation usually starts a few days before your appointment. During this period, carefully follow every dietary instruction given by your healthcare team. Most patients are advised to switch to a low-fiber diet. Foods such as nuts, seeds, popcorn, and raw vegetables should generally be avoided because they can leave residue inside the colon. On the day before your colonoscopy, you will usually change to a clear liquid diet. Water is the best choice, but clear broth, tea, and black coffee without milk are often acceptable as well. Avoid drinks that are red, purple, or blue, because they may resemble blood during the examination and make interpretation more difficult. When it is time to drink the bowel preparation solution, follow the instructions exactly as prescribed. Although the taste is not always pleasant, it is important to finish the preparation completely. For most patients, a split-dose preparation taking part of the solution the evening before and the remainder on the day of the procedure provides the best bowel cleansing. Be sure to finish the second dose at the recommended time and continue drinking clear fluids to stay well hydrated. Once the preparation begins, frequent bowel movements are completely normal. The goal is to produce clear or light yellow liquid stool, which indicates that the colon has been adequately cleaned. Before your procedure, tell your doctor about every medication you are taking. Blood thinners, diabetes medications, and iron supplements often require special instructions or temporary adjustments. Because sedation is commonly used during colonoscopy, arrange for someone to drive you home afterward. Most patients remember very little about the examination itself. Good bowel preparation makes the procedure faster, safer, and more accurate. Spending a few hours preparing properly can significantly improve the quality of your examination and help protect your future health. A clean colon today may help prevent colorectal cancer tomorrow. Thank you for watching. If you found this video helpful, please subscribe to the GI Patient Guide for more evidence-based information about digestive health.